So negative emotions, this is a very important one, and one that Stacy would do more justice to. But there are a lot of symptoms that can be associated with negative emotions. So fatigue, I myself, you know, suffered with, a number of ACEs, which we'll talk about in a little bit, adverse childhood events growing up, and that has influenced the way that I see the world and how oftentimes I will shift to shame, and that really does not help out with any of my relationships, but that has played a big role in my fatigue. Negative self-talk, self-criticism, not living in alignment with one's belief, feeling trapped in one's life, inability to forgive, perfectionistic tendencies. This is very common in people with fatigue. Major loss in your life at a young age, trauma at a young age, separation from parent at a young age, difficulty sleeping and insomnia. Physical symptoms with no apparent cause, anger that is difficult to control, difficulty quieting the mind, obsessive compulsive behaviors, loss of sexual desire, difficulty making decisions, brain fog or memory issues, difficulty tolerating social activity and a need to avoid others, erratic behaviors, easily agitated, mood swings, feeling overwhelmed, on the edge, or hopeless, having racing thoughts, engaging in risky behaviors to relieve stress or numb, withdrawal or isolation from other people, and increase in negative or difficult emotions. So these all can really contribute to fatigue. And then doing the adverse childhood events questionnaire, which we will talk about. And this test really, it doesn't have like a, some people say if it's above 4, then that's considered really significant. But any number that you have on there just kind of gives you some data around how much some of these adverse childhood events could be affecting your fatigue, could be affecting your life, and how, we all need to work on changing our mindset and developing an invincible mindset, a wonderful mindset, a happy mindset, in addition to changing the way that we see the world. So that's part of this whole journey that we're going on when you have a chronic illness, is really developing every aspect of you to be as healthy as possible. That is sometimes the gift of these illnesses, so that we can really develop a robust mind, body, spirit, emotion. And so we're going to talk about that more as we get into that chapter, into that module. Laboratory data, the elevated ACEs we talked about. And then in my experience, it's very likely that someone has negative emotions contributing to their fatigue if they have 2 or more of the above symptoms. And then ACE testing is supportive, but not entirely necessary. Make your distinction, yes or no.